Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by Village MD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD, and today we're talking about the hot topic of medical marijuana. I'm so thrilled to be joined today by Dr. Clive Fields. Clive is the Chief Medical Officer and founder of Village MD. Dr. Clive, how are you?
I'm great, Wendy. Thanks a lot for asking me to join you today.
It's such a pleasure to have a chance to talk to you about this. I have to tell you, this is a question that in my practice I started getting more and more of, and it's a fascinating legal issue for lawyers, and I know from a practitioner and primary care standpoint, lots of nuances as well. So just to get us started for our audience, if those of you who don't know or who are maybe trying to pretend like you don't know, sort of a newer statutory carve out in many states for the use of marijuana for medical purposes, basically relief of illness, disease, or medical conditions. We'll separate the use of medical marijuana, of course, from the concept of recreational marijuana, which hopefully people don't need me to explain what that is. The fascinating standpoint from a legal standpoint is that marijuana remains illegal under federal law. And even in the course of the current administration, when Jeff Sessions was our Attorney General, he had a personal issue with marijuana, and it was looking like enforcement was going to ramp up. We're not sure with Attorney General Barr what his personal views of marijuana are, but it creates a conundrum for professionals because marijuana is illegal under federal law. So when we're talking about medical marijuana, we're talking about state law, and we're talking about physicians who are going to be able to recommend it to their patients or sign an attestation that they qualify for it. But just for clarity, no physicians are dispensing or even really prescribing marijuana at this point. So we're showing you, if you're watching along, you can see here with the use of this map, show you the various situations in different states for whether it's legal, but there's so much nuance here, Dr. Clive. Even if it looks clearer, every state has its own nuances. And what can you tell us about Texas?
You know, I got to tell you, Wendy, there may never have been an area that I've read about that is not just nuanced, but changing on almost a daily, or at least as every state legislature is in session. And the state of Texas is interesting because it probably has, even though this map shows it as fully illegal, may actually have the most restrictive law ever passed in the country on the use of medical marijuana. In Texas, medical marijuana can be prescribed under the Compassionate Use Act, but only by a neurologist or psychiatrist, and only for the treatment of intractable epilepsy. So in Texas, very, very defined kind of use by certain doctors for a very specific condition. Across the country, though, we're seeing lots of articles being written about the use of medical marijuana in a variety of different symptoms and syndromes. Pain, it could be nausea associated with that, with cancer treatment, headache, insomnia, anxiety. I've even read articles recently about the use of medical marijuana, which is really kind of interesting, in the management of excessive weight. Typically think of marijuana as something that puts you on the couch with a bag of Cheetos, but it appears that in different situations that it may actually lead to early satiety and actually a reduction in weight. So nuances by state, lots of nuances in terms of the conditions being treated. But overall, if there was a message, it is doctor, prescriber, beware. Make sure that you know what the rules are, not just in your state, in your local medical communities, and not just that, what some of the literature does or doesn't support in the treatment of different conditions and symptoms.
Well, that's one of the things I think that's so interesting is that we all know there are patients and people who very vehemently believe that this is efficacious for their symptoms. Yet there's no literature because up until very recently it was illegal. So of course it wasn't being studied. Like you said, Clive, there's so many different risks. I mean, I have to admit, I don't actually even know this might be naive, but where do you even buy medical marijuana? And before you answer, reminder, this is a podcast, not a confessional. You don't have to tell us anything you don't want to tell us, Clive.
When you think about medical marijuana, that's actually being dispensed through the types of places that you would expect to dispense other kinds of medications. For a long time now, THC, which is the active compound in marijuana, has been available in two different drugs, Marinol and Sesamet. which have been available for a long time, typically used in the treatment of pain or cancer-related nausea, but they really haven't caught on. If you think about it, why is it that the availability of THC in a non-controlled way seems to have far more opportunities to be used or to be accessed than that in a controlled way? And people might say it's because the barriers have been removed and the cost has been lowered and things like that.
Well, that's the big question is, I was actually going to ask you is, in your opinion, is it efficacious? Does it work?
It's funny. I mean, we're talking today about medical marijuana, but I don't think a day has gone by in my practice in the last year where people have not asked about CBD products. And I think we clearly differentiate between medical marijuana and CBD. CBD products actually come from the hemp plant, not from the marijuana plant, and have been given almost mythological status in terms of it can treat everything for everybody everywhere, or into the back for low back pain symptoms. I'm seeing some patients asking and using it in the treatment of anxiety or insomnia. So it feels like people have taken kind of some of what they expect from marijuana and have actually applied it to CBD, even though it is not the same thing. And one thing I found interesting was that in CBD products, you actually can have up to 0.6% THC, which is a really, really low level of THC, but in some circumstances can produce a positive drug test. CBD seems to be taking, certainly in Texas, where marijuana is still effectively illegal, both recreationally and medically, CBD is taking the top line, but I don't think it's long before we see the same type of mythology that has been applied to CBD also being applied to marijuana. The challenge is, to your point, there's been very little real research done on the benefits and the risks of marijuana. I mean, I think we can all extrapolate our college experiences to our patient populations.
Again, don't have to confess. No confessions, Clive.
And I'm not sure that's doing our patient population a great service, because we all react differently based on what we bring to a medication. So I don't think people can say, because this happened to me or a friend or somebody that I knew in college, it seems appropriate now 30 years later to prescribe or recommend it for somebody with similar symptoms. I think doctors by nature are scientists, and we like to see data drive our decisions. And unfortunately, at this point, there's not a lot of data around true clinical studies around marijuana. So there is certainly a difference between what's healthy and what's not healthy, but I don't think anybody could really believe that smoking marijuana is, quote, healthy or in some way creating a long-term health advantage. So for both the prescribers and the users of medical and recreational marijuana, I think there's a lot to still be said around the buyer beware, seller beware. Be as informed as you can, but in all honesty, I think the jury's still out.
Yeah. Well, that's very consistent with what, the American Medical Association's guidance is, which most recently was updated in 2016. And a lot of people might think this is out of date, but their current position is that there's a high potential for substance abuse with marijuana and little scientific research about the efficacy. And so I think it is a beware. And just, to emphasize the point you made about the over-the-counter oils and creams and things, we're finding even in other areas, vitamin D or fish oil, many times that stuff is not tested. Of course, it's unregulated by the FDA. And so it's very difficult to know what you're actually getting. It is a buyer beware for sure. So do you get a lot of questions about this, Clive, in your practice?
Yeah, you do. You get questions about this in the same category as you just touched on, but most of the information around these products is far from actually scientifically based. There are doctors in my community, and I suspect communities around the country, who spend a lot of time becoming experts in these areas, whether it's around the use of nutritional supplements, whether it's around the use of other, what we would call non-traditional types of therapies. And I actually think there's going to be a great opportunity for physicians who are interested in truly becoming experts in the use of marijuana in the treatment of disease and illness to be of value in their medical communities. Those physicians or providers who are willing to commit the time and the expertise to learning and prescribing will be doing their patients and their communities a service, while those who kind of bring information they may have picked up either personally or anecdotally over the years to the table may not be as valuable to the patients they take care of, at least in the area of prescribing medical marijuana.
Got it. Yeah, I agree with you wholeheartedly. And I would say, as I said, over the last several years, this is a question I've been getting asked more and more as counsel. And I've come to the point where I've sort of recommended two different approaches. The first being, if you're in a medical marijuana state, many practices that I've worked with have just decided our practitioners will not be recommending medical marijuana. We're going to sit this out until more is known. Talking about the potency, the quality, the likelihood of contamination, looking at the AMA guidelines. So some providers, primary care practitioners in particular, have decided that. The other, I would say, option or decision that I've worked with practices in making is to develop some standards so that they have some consistency across if you have more than, a couple physicians. And I've seen standards that would include, we don't prescribe it for new patients on their first visit for obvious reasons that you don't want to get into a seeking kind of situation. Another example would be only for patients with certain conditions. Clive, you mentioned a couple in Texas that are very, as you said, very limited. Many practices are doing that and saying, here's the situations where we think it's okay. Other than that, no, we don't tend to recommend it. And the final thing, I've had groups that say, we're going to identify certain of us that go get CME. This is something you mentioned, Clive, and bring back training on dosage, side effects, counterindications. Nobody learned this in medical school. There's not good information. So having an identified person who can learn that and keep updated on it and educate the group about it is another way to go here. As we continue, we're going to see this evolve a lot, Clive, in the next 12 months and after. So these are basically, I guess, risk management advice and standards in the meantime.
Yeah, I think everything you're saying makes a lot of sense. I think about a drug as common as aspirin that is prescribed either in a baby aspirin dose of 81 milligrams or a full dose of 325 milligrams. And the risk and benefit profile is radically different in those two doses. Until we get comfortable with the appropriate dosing, potency, and symptoms that should be treated with marijuana, I think this is probably something that should be left with, as you said, practitioners who spent both the time and have the interest in really learning how to use this drug, and this is a drug like any other drug that we use this drug in the most appropriate way.
Yeah, good. Well, Clive, such a pleasure to talk to you about this. I didn't ever know you and I would be talking about marijuana, but hey, here we are. So it's been a pleasure.
Thank you, Wendy. I look forward to talking to you again.
Okay, appreciate it. Thanks, everyone, for listening. We hope to have you back for this and other important topics.
Thank you to our sponsor, Village MD. We hope you will join us for future concise compliance conversations.